Assalamualaikum doctors. In this video I am discussing about osteosarcoma. So osteosarcoma, how comes it comes? Maybe limping, it comes can be there is a swelling on the leg, so like that it comes. So if limping, we can ask, is it unilateral or bilateral? OCD when started, how long it is going on, anything make it better, anything make it worse. And if it is painful joint, we analyze the pain like shock rates, site of the pain, onset, character of pain, radiation associated with any symptoms, timing, course, exacerbating or relieving factor, severity scale from 1 to 10, other joints previous similar attack, then look, feel, move, how it look like, it is look like red, feel it, it is hot or tender, can he able to move his legs, general as usual FWASL, it is fever, unplanned weight loss, change in appetite, decreased activity, sleep disturbance, pain at night, and morning stiffness. Remember, pain at night and morning stiffness can be present. So it is a tumor malignancy feature. So we find that weight loss history present, loss of appetite present, decreased activity, so fatigue feelings, very important, pain, sleep disturbance. These general features is very important in osteosarcoma. Other concerns like any dysmorphic features, long term any medical condition or any chronic illness, if yes, all past history. So now systemic review one by one we asked. First of all, musculoskeletal system, MSK, skin spots, any pigmentation, skin lumps, joint pain, joint swelling, bone pain, hair, nail changes. So joint swelling, joint pain we will find when we examine. Then GIT about the tummy pain, tummy distension, recent change in poo and mouth ulcers. CNS about the headache, morning vomiting, facial asymmetry, curving of the back, unusual gait, unusual movement, mood change, eye deviations, any unusual features in eyes, any concern about vision, hearing, and speech. Hematology about the bleeding, bruising, recurrent bugs, all details, especially the sickle cell disease or hemophilia. Okay. Then chest, difficult breathing, recurrent bugs and chest pain, endocrine about diabetes mellitus, thyroid, addition to exclude other DD, urinary about the change in pee, amount, color, frequency and pain, swelling in the private parts, CVS awareness of heartbeat, heart racing, intolerance to exercise, easy fatigability and blood pressure. Then past history, very important, 5T IOA, history of any follow trauma, history of any travel. Remember sometimes arthritis with Lyme disease, so there is camping history can be present if it is Lyme disease. Then previous fractures, frequent falls, contact with birds, recent viral infections, acute myositis or transient synovitis. So recent, if any viral infections, it is recent history, then acute myositis and transient synovitis we can keep as DD. Parental history, any medical condition of medicines taken during pregnancy, screening for DDH, developmental dysplasia of the hip, any bone deformity that needed treatment, puberty if around its age, did earlier started menses. So puberty according to age, vaccinations as usual, allergy to food or medication, nutrition, anorexia, special type of food, development growth charts, loss of skills, difficulty in writing or wearing clothes, family history of similar condition and consanguinity, social history, school type, absence and performance, psychological or impact, how does this condition affect the family. So what is the DD? It is a case of tumor because we find there is leg swelling, fever, weight loss, very fatigue. These are behavior problems. So it is a bone tumor, our first DD diagnosis. It can be young sarcoma or osteosarcoma, mainly osteosarcoma. Rheumatological cause like GIA, SLE and psoriasis, trauma, infection, osteomyelitis and septic arthritis. Remember, osteosarcoma grow on the outside of the bones while young sarcoma grow on the bone tissue. Osteosarcoma are most often found around the knee. So knee joint swelling, knee pain, they can sometimes be found in the shoulder, upper arm, pelvis and skull, while young sarcoma is most often found in the pelvis, thighs, ribs, and upper arms. So, Ewing sarcoma on the flat bones and the osteosarcoma on the knee. So, this is all about osteosarcoma history. Thank you.